Hi guys, and welcome to CPR. In this video, we're finally going to learn how to perform CPR on adults. Now, we're going to learn this by first taking a look at the scheme and see how it looks like. Then we're going to take a look at how it looks like when someone is performing the scheme from start to finish. Then we're going to dive deep into the technique. We're going to talk about each and every step and how to perform it exactly. And lastly, we're going to watch a real-life CPR video that is going to tie up all the information that we're going to learn in this video. So I hope you guys are excited, and let's dive right in. Okay, but before all of that, when do we do and not do CPR? Well, we want to perform CPR in any case that our patient has no pulse, but it is not because of blood loss or because of a trauma injury. And we don't want to do CPR, well, in the opposite. In any case that our patient has no pulse, but it is because of blood loss or because of a trauma injury, in that case, we want to perform a different scheme that is called the trauma treatment scheme that we will learn later on in the course of how to perform it. But for now, let's focus on CPR and let's dive right into the scheme overview.
Hi guys, and welcome to the CPR scheme overview. Let's start out with safety. Safety means that we need to take care of our and our patient's safety. After that, we would want to check his responsiveness. A means he's awake, V means he's reactive to voice, P means he's reactive to pain, and U means he's unconscious. If he is reactive to voice, to pain, or unconscious, in that case, we would need to call for help. After that, we would want to check his pulse. If he has a pulse, we would want to check his breathing. If he is breathing, then it means he is passed out. In that case, we would want to keep his airway open and raise his legs up. If he is not breathing, then we would want to start to perform mouth-to-mouth once every 5 seconds, and we would want to check his pulse in between to make sure his situation doesn't get worse. If he has no pulse, then we would want to start to perform 30 chest compressions. After performing the first 30 chest compressions, we would want to open and clear his airway and give him mouth-to-mouth. We would want to give him mouth-to-mouth twice, once every 5 seconds. After that, we should continue performing cycles of 30 chest compressions and mouth-to-mouth twice, and make sure that every 2 minutes we stop and we check his pulse. We should continue this cycle until help arrives. Okay, now let's take a look at how the full thing looks like.
Okay, now it's time to dive deep into the techniques. Now, as you've seen in the CPR scheme overview, the first step in CPR is always safety. Now, when I say safety, I mean the helper safety, the first responder safety, as well as the patient's safety. Now, you first want to make sure that you take care of your own safety. And what I mean by that is that you should look around to see that you're not putting yourself in danger, and also that you will take 1 second to stop everything and just take one deep breath. Now, as stupid as it might sound, this part is very important. I can tell you 2 different stories. First one is of my friend who wanted to perform CPR on a person who just had a car crash that he witnessed. He ran over there and he almost got ran over by a truck because he didn't take a second to take a breath and he didn't look around enough, and the truck went over right near his face. Another thing that I want you guys to know is that even in emergency rooms in hospitals, doctors don't run to perform CPRs because they don't want to put stress on them. If they can walk there and take the time to take one breath, then their mind will be more in place and they will perform the CPR a lot more effectively. And so the first step in performing CPR is to make sure that you take care of your own as well as your patient's safety, which also means that if he is in the middle of the road, you want to take him to the side first. If he is in a burning house, you take him out of the house first. And if he is in the water, you want to take him out of the water first. Okay, now for checking responsiveness. Now, the way that we want to check his responsiveness is by doing something that is called AVPU, which means we want to assess his consciousness level. A means he's fully awake, V means he's reactive to voice, P means he's reactive to pain, and U means that he is unconscious. Now, the way that we check what is his consciousness state is by first just normally talking to the man. Hey man, how are you? Can you hear me? Hey, are you all right? Hello? Now, if he doesn't react, then the next step would be to check if he is reactive to voice by really strongly clapping in front of his face and seeing if his face twitches. Are you with me? Okay, he didn't react. The next step would be to check if he is reactive to pain. Now, the way we do this is we want to pinch these upper muscles that I don't remember their name. I think they're called the triangles. I might be wrong. But we want to make sure that we pinch these triangles with our thumbs really strongly on both sides. Actually, I'll show myself exactly how the triangle looks like. So this is the triangle, and we just want to pinch it really strongly on both sides. Now, the reason why we pinch this area is because we can't really do any damage to our patient, and that way we can see if he reacts to pain.
If we check his consciousness and he fully reacts, then he's awake.
If he doesn't react to us pinching him, then that means he is fully unconscious. We want to make sure that we would call for help immediately if our patient is not fully awake. So if we checked if he is responsive and he is only reactive to voice, he's only reactive to pain, or he is fully unconscious, we want to make sure that help is on the way. Which brings me to the next step. The next step would be to call for help. Now, I don't know if you're going to be surprised or not, but I have some tips for how to call for help correctly as well. The first thing you would want to do is, if you are not by yourself and there's other people around, then you want to make sure that you take your hand, you take your finger, and you start pointing at people. There is such a thing that is called the bystander effect, which means that if you just randomly call for help, like, hello, can someone help? Someone call 911? Then the problem with this is that every person will think that the other person will do it, and the responsibility will get divided by everyone. Now, we don't want that. We want to make sure that help is on the way. So what we want to do is we want to take our finger and say, you with the blue jeans, call 911. You with the red sweater, bring me a defibrillator. Okay? You want to make sure that you put a specific responsibility on specific people. Now, what do you do if you're by yourself? If you're by yourself, then, well, you don't really have a choice. You have to take your phone and you have to call 911 because you can't really point your finger at anyone. Cool. Okay, so that is how we call for help. Okay, now the next step would be to check his pulse. Now, the way we do this is we take our two fingers and we want to put it on his neck. Now, I want to show you the exact spot on myself, obviously, because he doesn't have any pulse. So the thing that you want to do is you want to take your two fingers, your index and middle finger, and you want to find this spot right where the chin connects with the neck, right here. There should be a soft spot, and you should press on it lightly, and you will feel a pulse. Now, you can do this on both sides. The side doesn't matter. You take your index and middle finger, and you find a soft spot right here. Cool. Now, I want you guys to practice this. It is very important that you will know how to feel pulse correctly if you choose to perform this kind of CPR. We will learn later in the course how to perform CPR without checking pulse, with only checking breathing. But personally, I think this CPR is more professional, and so I want you guys to be able to do it as well. So I want you guys to be able to always know how to feel a pulse correctly. Make sure you practice this on yourself as well as practice this on your friends or on your family. So after you checked his pulse, if he has a pulse, then the next step would be to check his breathing. So the way that we check his breathing is, first, we want to look at his chest to see if it is rising up and down. And personally, I really recommend to also put your ear on his mouth to feel if air is coming out. However, the chest is definitely the most effective way to know if he is breathing or not. Now keep in mind, there is something that is called agonal gasps or agonal breathing, which means that if you look at his mouth, then even if he has no pulse and he is basically clinically dead, then he might still move and look like he's trying to breathe, and that is called agonal gasps. Now, obviously, if his heart isn't beating, he is not breathing. So don't look at the mouth, always make sure that you look at the chest. So let's now check his breathing for a few seconds. Cool. I also put my hand on his chest to feel if it's rising up and down. But again, the most important indicator is to look at the chest. Now, if we checked his breathing and he is breathing, then that only means that he is passed out. If he is passed out, then all we want to do is to make sure that we keep his airway open and bring his legs up. Now, if he had a pulse, but he is not breathing, then in that situation, we want to perform mouth-to-mouth on our patient. We want to make sure that we do it once every 5 seconds, and we want to continue until help arrives, as well as monitor his situation. If we find out that he starts to breathe again by himself, then that's great. We don't need to perform mouth-to-mouth anymore. Or if we find out that he has no pulse, then we would want to perform CPR on our patient. So make sure that you continue to monitor the situation of your patient while performing the mouth-to-mouth. So not while performing it, but in the 5 seconds in between. Okay, cool. Now, what do we do if we checked his pulse and we found out that he doesn't have a pulse? Well, in that case, we have no choice and we have to perform chest compressions immediately to make sure that his brain gets the oxygen that it needs. Now, before discussing how to perform chest compressions, I want you guys to understand a bit the behind the scenes. And for this, I will talk about cars. You know how when you're driving a car and you start to accelerate from the car standing in place until the car reaches 100 miles per hour? Then you start really slowly and then the car speeds up more and more and more and more until it gets to the speed that you want. Well, that is basically what we're trying to do when we're performing chest compressions. We're trying to build up his blood pressure. And basically that means that we don't want to stop. As soon as we started to perform chest compressions, we're basically building up his blood pressure. And when we will stop performing chest compressions, it's like releasing our leg from the gas pedal, which will make the car slow down and down and down. And then we will need to start all over again. And so we will only stop to perform chest compressions only if we have to. So only in situations where we want to give him mouth-to-mouth. Now let's learn how to perform chest compressions. First thing you want to do is to take your strong hand and make a stop sign, like a stop. Then you want to take your weaker hand and you want to wrap it around. And now you have this position. And you make sure that your elbows are locked. Okay? Now make sure that you always perform CPR with the lower part of your palm. You don't want to perform it with the upper part. Next part is you want to find out the exact middle spot of his chest bone, which is usually between his nipples. Okay? But as long as it's in the middle of the chest bone, you're going to be fine. If it's a woman, then you try to imagine where the armpit hair would end, and that should be the same spot right in the middle of the chest bone. Cool. So now that you have your hands ready and that you know the spot, next part is you want to be exactly 90 degrees to our patient. So I don't want you guys to perform chest compressions like this from afar. I want you guys to be exactly above him. Now make sure that when you perform chest compressions that you will fully release when you press. So you guys want to press really hard, but you also want to make sure that you fully release. And now let's talk about the rate of the chest compressions. The guideline is that we want the chest compressions to be between 100 and 120 times per minute, which sounds like it should be hard to remember, but it's actually really, really easy because there is this song that is called Staying Alive. I'm not kidding, it's so crazy. Staying Alive, and this song is exactly the same speed that we want to perform the chest compressions at. So you just need to play this song in your head while you do it. Let's watch a demonstration of how it looks like. Cool, and that is how we perform chest compressions. So we just want to make sure that our chest compressions are strong and deep, that they are in the right speed and that we're doing them correctly. Now, when it comes to depth, You want to make sure it's 5 centimeters deep on adults, but if I'm being honest, you don't need a roller around to make sure that it's 5 centimeters deep. Instead, just make sure that it is strong, but it's not like all of your force and you're doing it and you're not killing him, but you are doing it strong. And if you hear that his ribs are getting broken, you hear click sounds, then don't get too worried. It can happen. This is not our goal. We're not trying to break his ribs, but this is something that might happen when we're performing CPR, and that is fine. Okay, cool. So now for next step. The next step would be to open and clear his airway. Now, the way we do this is, first, we want to just open his mouth like this. We want to pull his mouth downwards, and we want to look inside to see if there's anything blocking his airway. If there is some puke inside, broken teeth, blood, things like that. If we're doing CPR, then it's always puke. We want to take a look inside, and if we see that there is puke, then what we want to do is we just want to move his head to the side and just let the puke pour out of his mouth, okay? Usually we don't want to put our fingers inside unless we really have to, because in some situations his jaw might lock, and we don't want that to happen on our fingers. So best way to do this is just put move his head to the side and let the puke pour out, or if you can find something laying around, you can try to use that. But this is generally what we want to do. And if you have to, then yes, you can use your fingers. That's fine. Just be aware about this. And personally, I don't recommend doing that. Cool. So after you move his head to the side and you clean his airway, now you want to open his airway. The way you do this is, all you want to do is you want to make sure that you move his head backwards, okay? Really easy. You just want to make sure that you pull the chin upwards and move the head backwards. Now, when you do that, and you continue to hold his head in a position like this, then his airway is basically open. The reason why we do this is because when a person is passed out, he has no reflexes. And so, one of the most important reflexes are tension in the muscles. And what can happen is our patient can sort of swallow his tongue, like his tongue can block his airway. And just by tilting his head backwards like this, we're making sure that his airway doesn't block and it continues to stay open. Cool. So now after we opened and cleared his airway, next step would be to give him mouth to mouth. Now the way we do this is we make sure that his airway continues to stay open. We take our fingers and we close his nose, we open his mouth, and then we just go for it and we perform the mouth to mouth. Now make sure that while you do this, you try to look at his chest to see if it's rising up and down. You want to make sure that the mouth to mouth is effective. Cool. Now, you want to perform this once every 5 seconds for 2 times. And then you want to continue performing 30 chest compressions. Now, make sure that between breaths, when you're counting 5 seconds, you continue to keep his airway open and you release his nose, okay? And you wait like this for 5 seconds. So 1, 2, 3, 4, 5. Cool. Now after we perform twice, we want to continue to perform 30 chest compressions. Now you should count your compressions. What we want to do is we want to continue to perform sets of 30 chest compressions, mouth to mouth twice. 30 chest compressions, mouth to mouth twice. And we're going to perform this until help arrives. Now, make sure that every 5 sets or 2 minutes, it should be the same thing, you stop for a few seconds to check if his pulse is back. You just want to do this very quickly for a few seconds, but it is important to do so to make sure if we need to continue to perform chest compressions or if we need to stop. And that is basically it. We want to make sure that we continue to perform these until help arrives, and that is how we perform CPR. Okay, now the next thing I want us to do is to watch a real-life CPR video. Now, this video is really cool because you can see everything we talked about in the video. They have agonal gasps there, they're performing chest compressions there, and there's another cool thing about this video is that it is kind of old. It was filmed in 2006, and you can see that they're performing the chest compressions a bit slower than they should do that, and the scheme is a tiny bit different, but as you can see in the video, they still manage to completely save the patient's life. So keep this in mind. Even if you're not doing the CPR scheme perfectly, just taking action and doing something can really save our patient. So keep this in mind while we watch it. Okay guys, I hope you will enjoy the video. And And that's it. Let's take a look right now. Okay, and that is it for this video. Now, I know this was quite a lot of information to take in. You can always rewatch the video if you're not sure about certain parts. But the cool part about this is, after taking this video, you already know how to save someone's life if you'll need to. I hope you enjoyed this video, and I'll see you in the next one. Bye, guys.